So I'm Dr. Steve Meyers, and I'm here with my patient Nancy, and she's about 8 months after stem cell injections in both of her knees. And before we start talking to her, we're going to take a quick look at her x-rays. Okay, so taking a look at her knees, here's her right knee and here's her left. And if we take a look in at this right knee, she has good joint space. This is the amount of cartilage thickness in the knee. Good joint space on the outside of this right knee, but loss of space on the inside, and some spur development on the inside of the knee and some spur on the outside of the knee as well. Those are parts of arthritis. Looking at her left knee, again, good joint space on the outside of the knee, but loss of joint space on the inside with a big old bone spur on the inside here and some spurring on the lateral portion as well. Let's go back. Before you ever did stem cell, what was going on with your knees? What were your symptoms like? How were your knees doing before we visited?
Well, as a tennis player and pounding on courts for many years, they seemed to break down as the years went on. They were very painful. It was hard to get up out of a chair. It was definitely hard to get up off the floor. And the pain just seemed to increase as time went on.
And what kind of treatments did you have before we visited?
Basically, I've just done physical therapy and never had any cortisone or any injections of that sort.
But you did have some surgery?
I did have a meniscus tear at one time several years ago and had that repaired.
Okay. And then how was it like the day of the procedure as far as pain during the procedure, getting the cells and doing the injection? How bad was the pain during the procedure itself?
Not at all. It was very, very easy. I didn't feel any pain. It's no more to me than just getting a shot in the arm, although it's just in the knees.
Okay, and now we're 8 months from
Yes.
procedure. How are you doing?
I'm doing fantastic. It's the greatest thing I've ever done. I have sung the praises of this to everyone who will listen. I've referred many people to you. It has absolutely put me back in the game of life. It's changed everything.
So how do you have pain in your knees? Do they bother you?
Not at all. I mean, every now and then I might get some little twinge, just like everybody does, but I'm back to playing tennis 3, 4, 5 days a week. There's no pain. I can run on the court. I can get to the balls. I can do everything I did prior to this.
Are you requiring any pain medicine for your knees?
No, not at all. Everything seems to be, it's almost a miracle. I can't believe it.
Awesome. And are there activities you can do now that you couldn't do before, other than tennis?
I could probably, I used to jog a lot. If I wanted to, I probably could, although I do a lot of running on the tennis court, so I don't feel that's necessary. But I can bend down, I can squat, I can do all the things that I couldn't do prior to the injections.
Awesome. Well, having been through it, start to finish, do you feel like you made the right decision?
Absolutely, and I'd do it again in a heartbeat.
Well, thank you so much for coming and sharing your experience. I'm so glad to hear you're doing so well.
Thank you.